I'd like to ask our panel members, particularly about the temple, and if you'd give us an answer of what product you choose for temple revolumization primarily, or what is your go-to product when the patient comes in with that orbital rim skeletonization, because obviously patients don't come in and say, could you please, you know, treat my skeletal orbital rim, and what plane do you inject? So product and plane would be the question for temple rejuvenation. Amy?
For the temple, down on bone, and I do a bolus technique where I basically just go down in one plane and inject slowly and massage around it to make sure it fills it in, and I either use Perlane or Sculptra depending on the patient.
Could you, let's clarify a little more. Could you tell us what needle or what device you use to inject the product, and also an anatomical landmark of where you choose to inject it?
Okay. The Perlane, I use the needle that comes with it, and I inject just above the arch hair, going kind of a little bit at an angle of about 30 degrees until I very slowly advance until I hit bone, and I actually do pull back a little bit on my on the needle to make sure that there's no blood mixed in, and then I very, very slowly inject whatever I have, depending on either Sculptra or, like I said, or Perlane. And with Perlane, or with Sculptra, I would use a needle, usually a 25 gauge needle. That's probably about 1 to 1.5 inches.
If the patient has time, I prefer Sculptra, and again, I inject deep supraperiosteally with a 25 gauge 1.5 inch needle. And if the patient's daughter or son is getting married in a month or two and they want immediate, quick filling, then I like to use either Radius or a mixed Juvederm or Perlane with saline and lidocaine. And in that area, I inject with a cannula more superficially, and it's just in the...
So if you're using that cannula, Michael, you're on top of the temporalis fascia, right? I mean, yeah. I tried putting that cannula through the temporalis fascia. That's not happening.
No,
you know, you cannot penetrate the temporalis fascia, so you're superficial.
Yes.
All right. And when you use that cannula, you are reconstituting your HA products, or you're thinning it down?
Yeah, all the products, even Restylane HA products. I'm thinning down kind of. Val Lambros has a great little recipe of 1 part Juvederm, 1 part saline, and 1 part 1% lidocaine without epinephrine.
Okay, and you like to thin it down. Give us your reasoning.
Well, Val did some work on it and got incredible results, and the products seem to last long, and it also makes it a lot easier to inject, particularly with Radius. And a lot more affordable.
Okay.
And it's affordable.
All right. Becky?
Sure. So I use a couple of things in the temple. I do the Val Lambros dilution solution technique too, where you can do a 2-to-1 dilution with an HA. I use a cannula and I put it on the superficial temporalis fascia. That works very well for me in this part, right around the temporal crest. And I use a lot of Sculptra deeply underneath the temporalis fascia. I use it with a needle and I reflux before I put the Sculptra in. And I would have to say that I just want to share experience. In that HIV clinic, we would sometimes do 12 or 18 people in a day, and we do it a couple of times a week. And we did that for years, and it was not uncommon to reflux blood. And I know that's an avascular plane, so I can't explain it. What I speculate is that we were sort of pushing the vessel down, and then when you sort of hit bottom, then the needle would go through it, and you would pull back blood. But I think that you can hit a vessel down there, and we know that the external and internal carotid circulation is all intermixed, and we know that there have been cases of blindness reported with injectables all over the face, and that area is no exception to that rule. So you just want to do anything you can not to inject intravascularly.
Good. Ben?
So my technique is similar to what's been described. The only thing I would add is I definitely move towards the temporal line and make sure that I'm seeing a good correction with the volume as I'm injecting deeply. And in certain patients that have thicker skin, I may do some superficial injections with Sculptra, but Sculptra is my predominant product of choice.
I used to inject radius on a deep plane close to the bone, but what I found out that the surface, the transition to the cheekbones to the forehead was not so smooth as I wished it, and that's why I changed to a subdermal injection with blunt cannulas, and the product I'm mainly using there is bilateral balance, because it's really, it has the viscosity where you can smooth it out nicely and get the transitions to the eyebrow, to the forehead, and also to the cheekbones evened out.
This is such an excellent question. I have really firm ideas on this. May I ask Becky a clarifying question? When you refluxed blood in these HIV patients, were you right on periosteum, or were you perhaps a little higher than that?
Yeah, you could feel, you were, yes. And I know it doesn't make sense. I think that you push the vessel down and pin it. But it happened, I mean, we did so much of it for so long, but I mean, it wasn't like every day that you reflux blood, but it wasn't uncommon. I mean, it was enough that I got the feeling, I wanted to know if I was in there or not, you know?
And Becky, you were using a long needle, right?
We were using a long needle in the temple, yeah.